A lot of snake bites occur out in rural Georgia. Time is of the essence in these situations.
That day we were at church, we were at lunch. He was having a great day with friends, and then now he's fighting for his life in a hospital bed.
Keith, the father of Britton's friend, where he was at that day, called, and I'm friends with him, and the first thing he said was, "Shell, this is not a good phone call." And I, kind of struck me odd. Said, "What?" So this is not a good phone call. Britton was bitten by a snake. Cindy, John Henry's mother, got in the truck and was rushing off to the hospital. So I needed to let you know.
Whenever I got the phone call, the only thing I could think of was I just needed to be with my son. So I called my parents, and we were on the interstate. My dad, just so quietly and respectful, he just said, "I think that's them." And in the rearview mirror, we saw an ambulance passing us. Seeing and knowing my son was in an ambulance right beside me, I lost it. I just felt so helpless.
Some of the initial observations we made as he was rolling in were he had a lot of upper airway swelling, and that was causing him to struggle to breathe. He was also altered, so he was lethargic, not as responsive as we would have liked. His blood pressure was also dangerously low. That was pretty worrisome.
I walked in and I saw he was pale. He had on a face mask to breathe. He looked really sick, a lot worse than I thought.
Jared and Katie were both in the medical field, and so that helped us relate. So in this situation, once Britton's airway was secure, his blood pressure was at a level that's safer, and we started the life-saving antivenom, then it's time to get him to where he needs to be, which was a higher level of care. So that would be the intensive care unit.
So most of the first 24, 48 hours of care was really pediatric ICU care, and we were assisting with managing the antivenom response and dosing. So he first presented in anaphylactic shock to the response to the snake venom. The problem is when you're trying to assess a kid, especially in a kid who's on the ventilator, it's very difficult just by your physical exam. So we use a little tool that monitors the pressure in their, what we call the compartments of the leg. So we have to stick a needle into the leg, down into the muscle layer, and get a measurement of the pressure. And if the pressure is higher than a certain number, then we worry that there's too much pressure on the important structures like the vasculature and the nerves that are going to cause lasting damage.
The plan for that night was really just to let him rest, let the ventilator do the work. They had also started the antivenom. It was on the third day he started to wake up, and he looked at me, and he was still on the ventilator, and he mouthed around the tube, "I love you." And he used his little hands, and he pulled us in for a hug. And in that moment, I just felt like he's gonna be okay.
He was extubated, and he was coming around. The surgical team, the pediatric team kind of started to realize that the swelling was maybe getting a little worse, and there was some more redness developing around the bite site, so we probably needed another round.
It was very scary. How was he going to respond to it?
By our evaluation, it seemed like maybe the antivenom dosing wasn't enough, so we redosed him with antivenom, and we saw a pretty quick response after that.
The medicine worked, and the swelling went down, and the pressures went down. We were eventually in the right direction.
When he started to come around and wake up in the ICU, he was picking at his gown. The child life specialist, she was so helpful, and I told her, I was like, he doesn't like his gown.
So we provided Britton with some shorts and a Braves t-shirt to help him feel a little bit more normal.
When I put that Braves jersey on, it just gave me like a little boost of like, I want to get out of here and go get back on the baseball field.
We had a neat opportunity to visit with his friends that he was playing with that day. They were a little bit afraid for Britton to kind of talk about what happened, and we got downstairs with his boys, and they all talked about what happened and who did what and who was there, and it was just a really good experience for all of them.
That was their goal, was to get him out for his birthday.
Just everybody genuinely cared about him and wanted him to get home and celebrate his 9th birthday. And so when they wheeled us out of there, it was a really good feeling.
did what they were supposed to do, and the team worked effectively and well, and to see it work and get the right outcome for him is rewarding.
This situation, having a pediatric specific emergency department helped. He was very sick and he required intervention very quickly. And in order to have the right intervention for children, you have to have the right tube sizes. You have to have the right respiratory therapist that's trained to intubate or to help with intubation of these smaller airways. You have to have pediatricians who know the weight-based dosing for these things. And so because we're trained to do that, we were able to initiate that care a lot quicker. We have high-quality teams at all levels of care, and so we were able to work together kind of with the same level of expertise at every level that ultimately resulted in him having a really good outcome.
They're really nice, and they just really saved my life.
I'm just so grateful that there is a place that has all of the resources and the desire to help and to save my child's life.